Thank you very much, Commissioner Barnhart. And Brian Gottschall was able to work out the spinning circle of death on his computer and is ready for the Berks COVID-19 report. Brian Gottschall.
Yes, thank you, Commissioner, and thank you, Commissioner Barnhart, for stepping in and doing that in reverse order while I fix that problem. As always, we want to take a look at our cases and testing, and I'm actually starting to like this. For a number of months, I didn't enjoy doing this report because I felt like the bad news bear. However, things as they continue to look better, I feel better about giving the information now. So we see our case counts continuing to decline. In fact, we are now approaching the DOH set benchmark of 210 cases over the smoothing period as our objective. This is great news. It does, again, reflect back where we were back in the beginning of the summer last year. But I think we also have to consider the fact that testing is much more available, much more prevalent now than it was last year. So, we can't just say, well, it's looking like it was last year. Does that mean we're going to be back where we were again? We would hope that the prevalence of vaccine, the large number of people in our community that have been vaccinated are going to keep these case counts down, and we're not going to see a seasonal uptick as we move through the end of the summer into the fall again. Of course, something we all want to keep our eyes on and be prepared for the possibility of, but we need to remain optimistic and hope that we really are on the backside. Great news out of our hospitals. Again, as I always mention, this is a little bit out of date, and I apologize. The second week of 7/11 there should actually show last Friday's date. But we do get this information a little bit late, so we're reflecting last Friday's number, and these numbers include both known and suspected cases in-house. Great numbers, much diminished from where we had been, but even better news on top of the slide is in a conversation with some of the leadership of our local hospitals earlier in the week, we found out that St. Joe's, as of this week, had 0 patients in-house with known COVID, and Tower had 0 patients throughout the entire Tower system in ICUs with COVID. So those numbers are even better than the numbers that we're able to show on the slide for consistency. Our COVID deaths have flattened out over the last few weeks. We are still seeing deaths. We had an awesome period there of about 11 days consecutive with no reported deaths of Berks County residents. Unfortunately, then we did have a couple reports. And we're still seeing 1 or 2 a week, but clearly much better off than we were throughout even the recent few months, let alone back in the real thick of things. Our vaccine administration news also continues to look good. Again, we're 9th in the state, as we've mentioned for a number of weeks. We doubt that number will change because just due to raw population, it's where we belong in the list when looked at by population. But at the bottom of the slide there, where we look at the per capita information, we are continuing to make gains. Just in the last week, we're up 3 spots in each category, both fully vaccinated as well as at least first doses on board. And again, that information is as of DOH's reporting last Friday. A little bit of a change in how we report the vaccine overall. You'll recall that we've been using this slide, which was based on CDC data, shows that in Pennsylvania, we have about 59% of the population fully vaccinated over the age of 18. In Berks County, that's at about 53% of the population. However, then for this slide, where we wanted to look at kind of where we are at in Berks with respect to people that had first doses on board, and kind of what would happen if we just had nobody else start up but just completed the people that did start it, we had to do some kind of data manipulation to get to these numbers, and we showed them as estimates. The good news is that as of recently, CDC is now reporting in both of those categories, both fully vaccinated as well as at least first dose, and now we don't have to do that data manipulation to get to the numbers that we want to get to. We can just show the actual data that CDC is now making available. That correction in not taking into account estimates, along with the fact that we're just doing better week over week, sees a fairly significant drop in our number of new residents 18 plus that we need to get vaccinated to meet our 70% goal. So right now, if everybody that has started the process just finishes the process, it gets us to 64.3% of the Berks County population. What we need to see is 18,600 new folks, 18 and above, step up and agree that now is the right time for them to begin to get the vaccine to help us to meet that 70% goal set by CDC and the governor. So just reiterating a couple of the things that Commissioner Barnhart already mentioned, our vaccine center operated in conjunction with Berks Community Health Center out in Muhlenberg Township is available for your use. We can assist you with that either by going to doyourpartberks.com where you can register, or you can call our 888 call center to make accommodations to register. It seems like every few weeks we change the walk-in language at the bottom, and we went from, we went from just scheduled to walk-ins were okay but not preferred, and we're now at the point where I think we're saying walk-ins are just as good as scheduled appointments. If you would like to go to the vaccine clinic and just walk in and get your vaccine, no problem at all. Feel free to do that. And reiterating what Commissioner Barnhart said, just a reminder, we have about a week to a week and a half remaining, depending on whether you're talking Pfizer or Moderna, to begin the 2-dose vaccine regimen and still be able to complete that at the Muhlenberg Township Clinic. So if you're going to do the 2-dose regimen, it's a really good time to get that ball rolling. As we continue through the ramp down period in July, we will have the Johnson & Johnson vaccine available as a single dose option, but now's the time to begin if you want to do the 2-dose. And that's it, Commissioner. Thank you, and back to you if there are no questions.